we're going to solicit your ideas as well, because the HVCI, some of the funding for the HVCI is going away, but the work is going to continue, and we want to be responsive to your needs. Special shout out to Lisa Pasola-Frischman, who we see has joined us from Oregon. She is our facilitator extraordinaire for the HVCI Summit. So really, really glad to see you here, and glad to see some other familiar faces, or names at least.
Yes, absolutely. And apologies, folks, my slideshow closed, so I'm going to go ahead and open that back up.
We'll get back on track. As you can tell, this is going to be a really casual webinar today.
All right, there we go.
Here we go.
So as we mentioned, we're going to walk through the entire HVCI project by year. So folks joining us who might have hopped in halfway through or aren't familiar with the project can be up to speed. But similar to our last Lunch and Learn forum that we offered about a year ago, it was in March. We wanted everybody in the room to just kind of take a moment and ground themselves in the space, and we'd like you to just tell us how you're feeling today. So you can go ahead and type this link into your phone or computer, or you can scan this QR code here. And I'll leave it up for just one moment. And then I will go ahead and pull up the live word cloud and we can take a look together. So I will bring this back up in just one moment, but I am going to go ahead and get the live word cloud up. So I'm just going to pause sharing for one moment. There we go. So I'm going to go ahead and share the screen so we can see the word cloud populate. And I'm going to go ahead and make it full screen in just one second.
I can tell you I'm feeling at least 3 of these simultaneously.
Oh, I love the enthusiastic, upbeat, tired for sure. I said to Jen before we hopped on today that I'm tired. And I can go ahead and put the QR code up in just a second. Waiting for my little bar here to. There it is. Okay. So there it is back for anybody who needs to see it again. And the other thing that we can do is, since this is a live bubble, is what I will do is if folks are still adding their words in, I can always send out a little screen grab of it to our participants after today. I'm going to go ahead and close this out. We saw some folks are tired, joyful, so we've got a mix of emotions in the room. But again, we just wanted to offer that activity as, just kind of a little check-in. We like to do it just to see how everybody's feeling and coming to the space today.
Yeah. So this is our agenda for the next 45 minutes or so. We're going to walk you through the last couple of years of the Home Visiting Coordination Initiative, or HVCI. We're going to talk about the lessons learned. We've certainly learned a lot. And then we'll talk through the pieces of the work that are ongoing. Like I said, we're going to wrap this up by getting your thoughts on what we can be doing as we continue the project. We're going to talk about the public relations campaign, which hopefully you have seen. We're really excited about that. It's been a regionally based campaign up until now, but we're hoping to really take it statewide this next year. And then again, we need to hear from you. How can the HVCI support the home visiting workforce? What sort of ideas do you have for future webinars? So start thinking about those ideas, and you can stick them in the chat if you want to, or we'll open this up for discussion in a little bit. So first, we're going to talk about the history and how we got here.
Yes. Actually, first we're going to launch a poll. And I did just discover that I can't see the chat box while I'm hosting. So for that discussion-based portion, we will hop off of our slide deck. So first we want to get a sense, since the HVCI breaks up the state by region, where folks are joining us today. I do see we have a lot of our backbones on today. We're very excited to see you. So I know what regions they're from, but for the individuals who are joining us, I recognize many of your names who join our webinar series. We would love to know what region you're from. So folks are answering. I'm just going to give it a couple more minutes. Awesome. So it looks like most of you have answered, so I'm going to end the poll and share the results. We're pretty spread out, which is really exciting, with most joining us from the Mid-Hudson Valley and Western New York. So great to see that, but every region is represented, which is really exciting. So thank you for that. And if you are interested, I will drop the link to the HVCI website, throughout the session today at some point, and you can head over to the BBO tab and you can take a look at who your backbone organization is.
Yeah, and we can say that when we first set up the HVCI, we decided to kind of chunk out the state according to Governor Cuomo's Regional Economic Development Council regions. And so those were the 10 regions that we started with. We have since then split Region 6 and Regions 8 into two separate parts. And like Maggie said, we have a number of the backbone organizations on today, so please jump in at any point in time and share your thoughts with us. But we're so grateful to those backbone organizations, because we had at least one in each region that then kind of served as a hub for all of the work that has gone into the HVCI.
Right, which we'll talk about in just one moment.
So we launched the HVCI way back in October 2018. A number of us had been sitting at the statewide home visiting work group table run by the Schuyler Center for Analysis and Advocacy for a number of years. I mean, I think I'd been at the table for about a decade. And the conversation kept coming around to the fact that we have a number of really fantastic home visiting programs in the state of New York, but that the system is truly fragmented. Those programs don't talk to each other. They don't necessarily make referrals to each other. They don't exist in every community. And then, so there's a lack of coordination there. And because there's a lack of coordination and, to be honest, a lack of dedicated funding for home visiting, the workforce suffers. Programs weren't at their capacity, and parents didn't know about home visiting. So we wanted to launch something specific to coordinating home visiting programs within regions. So, for example, a Healthy Families New York program talking to a Parent-Child Plus program in their particular region, then talking to a Nurse Family Partnership program in another region, and then once they had coordinated, reaching out to other early childhood supports, so WIC and SNAP and lactation services and what have you, baby bundles in other parts of the state. So what we did was we wandered around the Capitol for a while, looking for some funding. And we had a wonderful legislative sponsor who hooked us up with a year's worth of funding to get this initiative off the ground. And what that entailed was setting up a website and starting the webinar series. And so that was the beginning of this. That first webinar back in, again, October of 2018 was a landscape overview that we invited the other home visiting programs to. They talked about where they were located and the work that they were doing. And then we were able to kind of ramp up the work when we received some additional funding. So we were very lucky to get federal preschool development grant B5 funding through the New York State Council on Children and Families, and some private foundation funding through Ed Trust New York and the Raising New York Coalition. So that's allowed us to do quite a bit of work. One thing we were able to do was we hired a coordinator who is no longer with us, but we also brought Maggie on as an intern, and the two of them went on a road trip in the summer of 2019 to really start to ramp this up and put some meat on the bone. So I'm going to ask Maggie to talk about what that looked like and how that road trip of sorts led to then the work that we took on pre-pandemic.
Yes, so that takes us to 2019, and which involved Jen and our executive director at Prevent Child Abuse New York hopping on the phone and identifying stakeholders all throughout the state. So Amanda and I went and met with our stakeholders that became the backbone partners and asked them to plan a regional summit. So bring all of the home visiting partners that you're familiar with in your region and do some digging to who else needs to be at that table. Maybe think about legislators, think about parents that could come to the table, as well as other early childhood services like Jen said. So then we subcontracted with those backbones and with facilitators that each of the backbones selected to kind of handle those first summits. So as you see there were 25 summits held throughout the state of New York, which culminated in a final report that was released in July 2020. So that kind of took the form of Jen, right, like, and our staffer at the time, taking all of those notes and documents from those 25 or 20 or so 10 facilitators rather, because we had 10 regions, and analyzing them and coming up with a report that posited 3 recommendations to the state of New York, which we will dig into. But the recommendations were to implement a form of public relations to talk about home visiting in the state, invest in workforce development, and pursue a system of coordinated intake and referral, which kind of laid the groundwork for what the HVCI would look like for the next few years. So fast forward, we took those recommendations and unfortunately entered into a pandemic era. So thought about kind of how we can help facilitate that work in each of the regions virtually. So that brings us up to our first statewide summit, which we'll talk about in just a moment. But during that summit, we talked about a statewide system of home visiting and how each of those 3 priorities and recommendations coalesce into kind of the North Star of universally offered home visiting. Do you want to talk about 2021?
Yeah, so let me back up just a little bit to that first summit. Oh. So like Maggie said, those 3 themes that emerged in the final report really pushed upwards towards a North Star.
Wendy, if you get a chance to give me a call, can you check the iDrive?
One moment.
It looks like everybody to mute.
And I don't know if I'm just
Okay.
So the ultimate goal would be universally offered home visiting. And so we reached out to Senator Elizabeth Steiner Hayward in the state of Oregon. Oregon's the theme here today. And talked to her and her staff about what they had done in terms of coming up with a universally offered program. And she agreed to be our keynote speaker for that first statewide summit. And then that kind of led us into the opportunity to present at the National Start Early Home Visiting Conference that following February, where we talked again about the work of the HVCI and our ultimate goal of universally offered home visiting. The work continued. As everyone of you know, everything pivoted to being virtual. And I have to say, there were definitely some cons to that, but there were probably some pros to that as well. I think that our webinar series became really popular because people were looking for something to do and to learn and to engage with other people. The BBOs and their regional teams continued to work. And in June 2021, the mid-year report was released.
So that was just our backbone organizations talking about the work they've done thus far. It's available on our website, which again, I will link to just as soon as I have my chat box back. But it talked about kind of each of the regional groups meeting and what they were talking about and the goals that they had thus far, which brings us to September. We had our next statewide summit. The theme of that was taking the PR materials, which we'll talk about on the next slides. We have a slide for each of the years that we're kind of outlining for you here. But our PR campaign that we had designed as kind of a response to what we saw in the mid-year report and what we saw from the initial summits. We wanted to learn how to message it in each of the regions and give the backbone organizations some information about how PR campaign might support some of their other priorities. Which brings us to, we decided to release a toolkit in April to further kind of support backbones in providing materials for those PR materials. And then finally, the last summit that we just had, which kind of wrapped up the HVCI in terms of overviewing what we've done thus far, looking back, and then looking forward into the future, which is why we're offering this session today. We had an opportunity to meet with our stakeholders, and now we want to hear from the workforce. We want to hear from the members of those regional teams and bring everybody into the space.
So this just kind of, again, year by year outlines where we were and how we got here. Again, thank you to our legislative champion, Assemblymember Andy HVCI, for that first chunk of change to get this off and running. And I'm going to ask you to talk a little bit more about the webinar series and who we partnered with and what kinds of webinars we've had.
Absolutely. And this is by no means an exhaustive list, but do want to say a huge thank you to our state agency partners. So the Office for the Prevention of Domestic Violence, the Office of Addiction Support and Substance Abuse Services, OASIS, Office of Mental Health, Department of Health, the New York State Council on Children and Families. I'm trying to think if I've missed any. And then also our nonprofit and other coalition partners. So Schuyler Center for Analysis and Advocacy, New York State Coalition Against Domestic Violence, and Mahaney's Mental Health Association of New York State. I apologize if I'm missing anybody, but there is a list of all of our webinars that we've offered. And I think it just goes to show that it was an opportunity for learning and the benefits that we all gleaned from partnering and having these conversations were monumental. And we will get into this when we talk about our plans for the future, but I'm happy to say that Prevent Child Abuse New York and I am committed to continuing to offer the webinars every month.
And so again, 2019 to 2020 was that first official year of work, 25 summits. Maggie and Amanda went from one end of the state to the other. And I will say that we went into the project thinking that we knew what we were going to hear from people, but we wanted to make sure that we were right. And so we had it in the back of our mind. And then these three themes emerged: coordinated intake, workforce development, and the need for a public education campaign. And so we were really glad that our hypotheses kind of worked out for us. You're going to see some of the work of the public education campaign. I will say that the intent is twofold. One is to dispel myths and bust some stigma around home visiting. You know, it's not a gateway to CPS. And the other piece is to increase access, to support investments in programs as well as investments in the workforce. You know, help to hopefully make people feel a little more appreciated, help to increase those referrals, and you know, end up with more families being served.
And I will say these slides were kind of just a resource, intended to be a resource for you, so we understand we're kind of running through them very fast. So I will send them out to folks after the call today.
Yeah, and this is just a, you know, again, kind of a little bit of a recap of how we worked with the BBOs, or the BBOs worked with us under the direction of various facilitators to get us to a point where we could have that summit with Senator Steiner Hayward and talk about Oregon's vision and implementation of universally offered home visiting, which hopefully, as we kind of put on our advocacy hats separate from the federal funding that we receive here, to move towards a universally offered home visiting system in New York State.
which we will gather your feedback about in just one moment. A little nod to what I asked you to do previously in the slide deck. Again, shout out to our summit facilitator, Lisa Fasola-Frischman. We know you're on the call today, but this was one of your ideas and I absolutely love it. So this is the first word cloud that we made together as backbone organizations and as regional partners. So I don't know if some of you joining us today had joined that first initial summit, but if not, hopefully you can just see kind of the words that people were putting in and feeling after the summit. And I think it just kind of set the stage for the next few years. So I wanted to bring that back up again and hope that this energy continues even after the project, the funding for the project comes to a close.
Yeah, I think it's important to note that we really could not have done any of this work without the people in the field, right? The home visitors, the other folks who work in different systems, and the families. You know, we looked to, when we developed the PR materials, we looked to parents to influence the language there. And so this excitement and this hope really got us through, especially when we hit the pandemic and thought that, you know, we were going to have to scrap everything. We were really, really energized by the folks in the field. So I'm going to let you talk about this.
Yes. And again, we alluded to this during our timeline overview at the beginning of the presentation, but so we get to 2021. And as Jen said, we were feeling a little confused and how do we do this? What are we going to do? How are we going to implement kind of a statewide initiative when we can't travel and when each of the regions is facing so many challenges and, you know, other priorities that were incredible, you know, took precedence, you know, for the time we were in. So we decided to try to give some concrete materials and help in any way that we could, which took the form of creating a PR campaign, creating graphics. So as Jen mentioned, one of the first things we did, in addition to finding our designer and sitting down with her and kind of talking about our goals, which were to uplift and coordinate those other priorities we've previously outlined for you. We asked our BBOs to send us some parent representatives, and we met with the parents and kind of asked them, what would you like from a PR campaign? Met with them a few times and they helped us to mold the graphics and some of the words that are on the posters, which unfortunately I didn't put any pictures of in here, but they are available. I'm happy to send them out to individuals after the call today. And then we also met with, we relied on the backbones to kind of put us in touch with the workforce. We talked to home visitors during some regional meetings. Jen and I popped into, I can remember specifically, I think Southern Tier, Region 3's meeting, Central New York, Region 4. We asked individuals, home visitors or other early childhood professionals in the room to talk to us about what kind of language would resonate and how would you like the profession to be represented. So we came out with this PR campaign and released a toolkit to our backbone organizations that included social media posts, guidance for creating a testimonial video, and also hired a consultant who has expert in marketing and a messaging expert, like I mentioned, to present at the statewide summit that was virtual to help us wrap up the PR campaign in a little bow and help BBOs understand how to implement a toolkit and message home visiting according to each regional need. So each, you know, kind of goal and priority in home visiting was different depending on what region they were in.
We should say too that the reason that we landed on these characters, which we think are really cute, came from—
I missed a big thing here.
Came from the Talking is Teaching campaign that hopefully some of you have seen, statewide Talk, Read, Sing. The preschool development grant that New York State received from the feds was funding this campaign at kind of a higher level, a statewide level. And so we spoke to New York State Council on Children and Families about adapting those characters and using them for the home visiting campaign. We did give it a try. Like Maggie said, we had a couple of focus groups. We asked them for their thoughts on using the characters. by and large, people thought it was a good idea. It made sense to us to continue what was already a statewide campaign. So our graphic designer, added some baby bumps and the little home visitor guy that you see there. We did 3 flyers,
Yes.
basically. One that's if you've seen Talking is Teaching, each of them starts with, let's talk about X. And so our first was, let's talk about home visiting. It was very, very basic. The second one got into more specifically the benefits of home visiting. And then the third was geared towards healthcare professionals, because one of the things we heard in those the regional team meetings and the summits that the BBOs held was that most people are either referred to home visiting program through word of mouth or through their doctor's office or their baby's doctor's office. And so we wanted to have 1 or 2 flyers that went out to healthcare professionals, not just the doctor, not just the nurse, but the receptionist and front of office staff, so that they understand that they can make that connection with their patients. And so again, those are on our website, but we will share those when we send out materials after this. They're free and they're usable for anyone. And we specifically crafted them so that they are tailored for each region to add their own information. So all the front pages all look the same. The back, each BBO could add their local Healthy Families New York contact information, if you will.
Right.
Oh, the blending and braiding guide.
Which brings us to today. So looking forward, 2022, as I mentioned, we held our first in-person summit and unfortunately our last, but it was exciting. And we finally got to meet some folks in person for actually the first time and talk about all that we've accomplished. We released the Blending and Braiding of Funds to Support Home Visiting Guide, which I think was a lovely complement to all the work we've been talking about, talking about funding home visiting in the state, talking about how we can get it to more families. So just this guide is a 72-page booklet of information about funding mechanisms to support and sustain home visiting programs in the state.
And there is a webinar for those of you who don't have time to read 72 pages.
Yes.
Maggie did a very nice kind of half-hour, 45-minute webinar that hits the high points. So again, on our website.
Yes. Okay. I'm trying to think the best way to do this. I guess I can stop sharing once we put the question up.
Yeah.
But we wanted to take the first half hour to walk through the project and just kind of level set for individuals. I'm sorry if to the BBOs, apologies for duplication, since we've talked about this project now a lot, but we wanted to get some input from other people in the room. So first question we have and you can please unmute yourself. And we have like 40 folks, so it shouldn't be too overwhelming, or chat in some ideas that you have for future webinars. And we would love to hear from home visitors or from our backbones or partners in the room, ideas that you have.
And I think we can do a teaser for probably our first webinar of the new year will be around oral health. So we're excited to partner with the Schuyler Center on that.
Yes. And actually, I'm going to stop the recording now so everybody can talk freely.